Hi everyone, it's Kristen Darcy and it's our Tell All Tuesday for September 5th, which is leading off PCOS Awareness Month, and I am over the moon excited to be with Sasha Ottey, who is the Executive Director of PCOS Challenge, and I'm so grateful to have your wisdom again this year. I look so forward to talking to you. So, hi, how are you?
Hi, Kristen. It is such a pleasure to be back here with you. Love speaking with you. Love speaking with the Tell All Tuesday group. And just excited to speak about PCOS awareness and how everyone can get involved. This year is a pivotal year for PCOS awareness, and we're just super excited.
Well, I so commend you because you're an organization of advocacy, and I reached out to you and said, we have to talk about what happened within a year, so I would love to just start there, or maybe we could go there second. Maybe you could just give a recap to people who are listening in and saying, what is PCOS?
Yeah, well, if you have not heard of PCOS, you're not alone. And yet PCOS is the most common hormone disorder in women. PCOS affects 10% or more women in the United States. That's over 7 million women, up to 15% by certain estimates. And it's unfortunate and quite a disservice that most of us don't know about PCOS. PCOS it has a lot of risk factors for long-term complications in women and women's health. It's the most common cause of infertility in women. Women with PCOS constitute the largest group of women at risk for developing type 2 diabetes, cardiovascular disease. It also puts you at high risk for certain cancers. You're 3 times greater risk for developing endometrial cancer if you have PCOS, especially if you're overweight or have obesity. So PCOS is a really serious condition that has not gotten the attention or awareness that it's needed. In fact, 50 to 70% of women with PCOS are undiagnosed or misdiagnosed, which is a huge problem, putting us at risk for these life-threatening conditions, which we may not even know we have risk for. It's not all bad news, though. I think once you get this diagnosis, once you understand what's going on with your body, this is, the knowledge can empower you to make certain changes that, certain lifestyle changes that can help to improve your health and quality of life and longevity.
So let's just say PCOS is polycystic ovarian disease.
PCOS is
syndrome. Sorry.
It's polycystic ovary syndrome, polycystic ovarian syndrome, PCOS. There are a few names that we can use to describe this syndrome. If you've ever seen your gynecologist or family medicine practitioner and they mention, well, maybe they're polycystic ovary, this is probably what they're talking about, especially if you have irregular periods or irregular cycles, irregular ovulation, or you have certain signs of increased male hormones, such as adult acne or facial or body hair in places where most women don't want them. Or if on ultrasound, a gynecologist has told you that you have these little polycystic ovaries. That's different from, some of those other cysts that may burst. These cysts in PCOS are these tiny immature follicles that are plentiful in your ovaries, and your ovaries may also be enlarged. So definitely, if you have irregular cycles, if you have facial hair or acne, if you have obesity, or if you have trouble losing weight and you gain weight really easily, these are some of the signs for a lot of people that you may potentially have PCOS. Now, not everyone with PCOS has obesity. There are lots of lean women with PCOS who their physicians may or may not even consider that they have PCOS because they're lean. So this is not true. You can be a lean woman or even underweight and have PCOS, especially if you exercise a lot, or you know, some women just don't have that, haven't had that gene that triggers obesity as others do.
Right. And is it true that some women also experience hair loss with?
Yeah. Yes.
You
So
touched on the characteristic of hair where women don't want that, but
yeah. So another symptom of this androgen or male hormone excess is hair loss. It's not talked about as much, but a lot of women, especially with really severe PCOS, can experience balding and in the back of your head, kind of in a male pattern, or at the sides, the temporal, like a female pattern here, hair loss. And this is something to bring to the attention of your physician. I know a lot of us women are very, very skilled at hiding some of these things that may, you know, these are some of the things that we hide. We shave or wax or laser or electrolysis, or wear wigs or other things to cover up balding.
Right. Because that's why you're so important, because if you're not aware that these traits could, you know, if you connect all of these would lead to PCOS, then you're going to feel uncomfortable and take steps to mask them. But in actuality, it's as if your body's screaming to you, oh, something's off inside, something's out of balance, you know, look in and look within, you know, seek help. And that's what is so powerful about your organization. And I wanted to touch on it because I had a client actually go to, you know, a few, but this one it just brought it to my attention recently. Like last year was really life-changing for her to go to your event. And that's why I'm so grateful that we're talking today, so that people could plan if this is calling to them or resonating to them. But she really felt, she came back with such a divine sparkle back in her, that she was heard and acknowledged, and with other people who understood. And I just feel so strongly that, you know, we share this, that you can create a community of women who know it, who get it, who advocate and understand, so that people who are home listening to this aren't alone, that there is your tribe, you know, your group, your posse, as I call them, like, you know, who's your five, and you could go there and get your five, you know, so I love that.
Well, thank you so much, Kristen. Thanks for bringing that up. And something powerful happens when women get together, and something powerful happens when women with PCOS get together. Some may have felt alone, like no one understands PCOS or how it affects them. But when you're in a room with hundreds of other women and their family members who understand exactly what you're going through and can share ideas and share experiences, this is a really empowering.
Right. Oh, I got so many goosebumps.
It's really, I mean, it's really emotional. There are lots of tears too, lots of hugs, lots of tears, lots of, because for some, and actually this past weekend, I attended Congressman David Scott's health fair. And his focus this year was on, of course, women's health, but also veterans' health. And this woman, she was a veteran who had PCOS. She came up to us, she had never, ever experienced anything where there's PCOS awareness. There was a sign that said PCOS, learn about PCOS here. So PCOS Challenge was there, educating the community about PCOS, about polycystic ovary syndrome. And she was moved to tears because she's been dealing for decades with PCOS and hadn't been diagnosed. She was 48 and thought that her window had been closed to conceive a child. No one had ever uttered the words polycystic ovary syndrome to her. And she felt so angry and so emotional that, you know, she's been dealing with hirsutism, all the signs of PCOS, and no one had connected the dots to her before. That's why this work is so important. That's why it's so important to bring people together to advocate about polycystic ovary syndrome. It's affecting not only women, not only girls, but their families and friends and people who love them.
Right, right. That's why I'm so grateful to you, because, you know, we talked about advocating, you know, learning to advocate for yourself and emotionally, and that woman that you talk about, and even for me, it was as if your inner voice is telling you something's not right. You know, something's not right here. Something's not right, and it's uncomfortable, and you know it's not right, and you search for answers and you don't get them. But it's that empowerment that you get within the group. You know, you have to give information where it is, but you also have such an online resource, online connection, that empowerment to be able to stand and say, no, I know for sure this isn't right. You know, just like that you said about that woman, she's been searching and wanting answers. And
most of us experience symptoms in our teenage years. So a lot of people retrospectively think, there's been, I can think about back when I was 12 years old when I was experiencing this, or I had hair on my face where other girls didn't have it, you know, or I was experiencing these emotions and I couldn't put the pieces together. And unfortunately, many women struggle decades feeling this sense of confusion and being alone, and it only increases anxiety and depression.
Right.
You know, without that support, because if you don't know, your doctors don't know, your families don't know, but the one thing you do know is that something is wrong.
Right, right. Well, we you know, as a mom of a teenager, there's so much going on at that time in your life that, you know, watching, especially the change in, you know, social media and everything. And that's why to have a clear voice that you are present on social media about what PCOS is, because it's, you know, there's a lot of noise out there, you know, and a lot of noise in here, right? So to be able to talk about that, and I know you and I were talking before we went live about that, about how a teenager experiences these symptoms, and if you're a woman who is not ready to start creating their family and then they take birth control, that the birth control has there's a positive and a negative, because it calms the symptoms, because your inner balance hormone, I'm not a doctor and we're not saying that we are, but you know what we've realized, you know, working with women who have that diagnosis later in life, is that because they were, you know, trying not to achieve pregnancy, or for whatever reason was on the birth control when they came off, then this condition was, you know, I don't want to say blown, but brought to the forefront, because the hormonal balance in the period, which might have been regular on the pill, started becoming irregular. So I'm so glad you brought up that little 12-year-old girl, because there needs to be awareness about this, not in fear, but in empowerment way, that this is something that you need to have a discussion with your physician with, or your.
Yeah, absolutely. I think what's the first thing that many doctors prescribe when you have PCOS, or when you're experiencing certain symptoms with your periods, maybe heavy periods, or prescribe the birth control pill.
Right.
A lot of teenagers and girls with PCOS have been on the birth control pill from early years before diagnosis. A lot of people do get diagnosed once they get off the birth control pill, be it to conceive or, you know, just
To give their body a break or
right, whatever reasons you may come off the birth control pill. But then a lot of birth control masks a lot of the symptoms of PCOS. So unfortunately, when a lot of women with PCOS get off birth control, and then the symptoms rear show their ugly faces, this is when a lot of women get diagnosed with PCOS. When they get off birth control pills and try to conceive or for whatever reason, and then the symptoms, be it the hair, the weight gain, the just irregular periods, these symptoms really do show up for that. Yeah. So this is something to look out for when you do get off birth control pills. Are you experiencing some of these symptoms? Are you experiencing, increased acne or facial hair or hair loss or weight gain or regular periods? These are things to be sure to tell your physicians and bring up when you get your Well Women consult.
That's perfect. Thank you for touching on that, because that was just a recent client that I had a similar situation that she didn't know. They didn't know before and she didn't know after. So I want to spend a little time talking about the conference.
Yes. So on September 16th in Atlanta, 16th and 17th, we're having an entire weekend dedicated to PCOS awareness. This will be at Georgia Tech in Atlanta. On September 16th, we'll be having the symposium, the PCOS Awareness Symposium. And on September 17th, we are doing the Bold for PCOS 5K. This is really, really super, super exciting because this is an opportunity for hundreds of us to come together to learn about PCOS from some of the world's leading experts in the field, and also to share our experiences. I want everyone to come with a business card or write your name and number or email on a piece of paper. You need to, find your five, right? Right, yeah. Kristen? You connect with at least 5 people while you're there. Meet new people. Often we have parents of girls who have PCOS who want to connect with other parents, who want to connect their girls together so they have people in their age range who are dealing with the same thing. So use this as your opportunity to make the most out of these events, right? So come prepared with your questions. We have physicians, we have researchers, we have nutritionists, dietitians, we have patient advocates, vocal patient advocates. We're going to be speaking about what's happening in the PCOS space, how you can be an advocate. We're going to speak about and I'm sure we'll touch on this a little later, Kristen, but House Resolution 495, which is the resolution that we introduced in Congress, the first ever PCOS focused bill in Congress. This is big. This is huge, and we do need to band together for PCOS awareness.
I want you to go right now and talk about that bill. I've been not a stalker, but I've been following on all the social media. So give us an update about the bill.
Okay, so PCOS Challenge, we reached out to our congressional representative, David Scott. He's been a huge advocate for women's health. He's also supported fibroids and endometriosis. And so just women's health issues that don't get the support or attention that they deserve. And PCOS is one of them. Most people have heard of fibroids or endometriosis in Congress, but I tell you, it's an awareness push. That's what this resolution is. It's House Resolution 495. It's designating September as PCOS Awareness Month, and also recognizing the seriousness of PCOS, polycystic ovary syndrome. So, I mean, this is huge. This is the first time that women have had a platform to reach out to their representatives in the U.S. government to ask for them to support PCOS, support women and girls with PCOS. This is huge, Kristen.
It is huge. It's huge, and I'm in awe of you about it. It's huge, and it's profound. It's just time to bring the light to this because of the long-term effects for women's health, for women who have PCOS. And so it's
for women who may have PCOS and their offspring, their daughters, their sons who are at high risk for diabetes and cardiovascular disease. So this affects entire families and communities. And so we pounded the pavement at the U.S. At the U.S. Capitol, and reached out to representatives from all over the U.S. And we did get the support of 21 absolute leaders in the U.S. government, and we're getting others to support us. But how you can help is if you call or email your representative, and you can find out who your representative is by going to house.gov. So you find out who your representative is and send an email to your representative, your congressman or congresswoman, and ask them to support Res 495. That's House Resolution 495, which is the PCOS awareness resolution.
Well, all that information is going to be right under this video on YouTube and when we share it. So it'll be easy peasy lemon squeezy to take.
Wonderful. Another important
and follow through. And if you're not a person who's an advocate that wants to go out and go to the, go person to person, this is something that has a long-term tentacle benefit. And so we encourage you to hit the link and email and say, please be aware of this. Because you know what? Chances are that person is connected and touched by PCOS and doesn't even realize it yet.
Does not know. And this is how I keep going, Kristen. I remind myself it's bigger than me. This is not about me. This is not just about me. It's about my family members who have PCOS. It's about your family members who have PCOS.
And it's about changing the future.
About changing the future.
It is because we didn't know. And some people still don't know until it personally affects you. And that's just like you said, that woman who was in the military, your story that you shared. It's important to take action. And
it is.
I would greatly appreciate you clicking the link, and we'll even put the email text right there, and all you have to do is cut and paste it. It's easy peasy lemon squeezy.
Yes, thank you so much, Kristen. And I didn't get a chance to touch on or to really speak about the Vote for PCOS 5K that's coming up in Atlanta. If you like to walk, if you like to run, please sign up, sign yourselves up, sign up as an entire family. That's what a lot of people are doing. They're bringing their husbands, their daughters, their sons, their dogs.
I love it.
to come out and advocate. And this is a good way to advocate for PCOS awareness. Help to raise funds. The only way we're able to do this is with your help. There are no grants that say PCOS. I'll be blunt. Most organizations, grant-making agencies are not interested, or they don't know about PCOS. Right. They don't know they should be interested in supporting PCOS. So we work really, really hard, Kristen.
I know you do. Honey. That's why I so want to honor you and help spread the word, because you do. You're dedicated, and your fortitude and your persistence. I mean, you're making it happen on a shoestring. So
yeah, Well, thank you so much. I mean, it's advocates like yourself, Kristen, who reach out to your audience and you educate people about this, and you speak one-on-one with patients or with clients who have this. Your support, your source of support for many, and I'm very, very thankful and grateful to you as well.
Well, I so appreciate your time and your expertise and your wisdom. And I won't be with you in person on that weekend, but I'll be with you in spirit, sending tons of love for healing and moving this forward to into the light. And I thank you for what you've done for my clients, because it is profound and life-changing. So all the information you need about everything we talked about will be right under the video, and you can just click the link. And of course, you can go to your website, which is pcoschallenge.org, right?
That's right. That's right.
Awesome. So thank you so much.
Thank you, Kristen. It's a pleasure being here with you again. And we look forward to continuing our great work together in honor and support of those who are dealing and battling and struggling and being empowered.
And thriving after empowerment.
Thriving. That's what we do. We're PCOS strong, and so we're tougher than PCOS. I have shirts that say it, shirts don't lie. No, I'm tougher than PCOS, and so are you, even when it doesn't feel like it. I think evolutionary, like we have, we're tough women. We deal with a lot, but I mean, we're built genetically to deal with a lot, and we will overcome, and we will be PCOS, and together we can do it together, right?
You have to go and get that juju to fill yourself up to move forward, and no, you can thrive through it. You can, with education, support, and advocacy, you can thrive. So I love you. I love what you do.
Thank you.
See you later, everyone. All the information is under the video. Please click and share and write and join in. And of course, if you have an extra few dollars, support this, because it's a huge endeavor. So bye, everybody.